I didn't start this or develop these protocols or do the research for music's sake. In fact, that was not even on the front burner. I was looking for strategies that could engage people in health and wellness. But I realized when I listened to music and I participated in making music that I felt something change inside.
Music may be the most sophisticated, or i.e. cortical-like, human language for communicating emotions, yet its power is dependent on the arousal of subcortical emotional systems. Therefore, it seems that music ultimately evolved from our intrinsic emotional nature, i.e. subcortical animalian structures, and the ability to communicate first affectively and then musically established a necessary, though perhaps not sufficient, neuropsychological groundwork for language.
When I took the workshop with Dr. Bittman back in 2009, it was such an, I think I walked out of the room after 3 days, and I was transcending. I was off the floor, it felt like, and I said, I'm going to use this with addictions. I was totally sold on it. So what I did, I gathered data for my medical director, who is really into stats. He wants to see the science behind it. So I had, I don't know how many pages, 150, 200 pages of data, and I took it to him. I said, this works, and I want to do this. And I gave him all the information. He read every page. So then I had to go in front of a panel, and they were firing questions at me. Well, why do you need this, or why do you need that? How does it work? And I didn't know if I did a great job or not, but they bought it. So the next day I said, wow, I said something right. And that was kind of the beginning of it. And I was collecting coffee cans at the time because I was going to do this whether I could get a grant for drums or not.
I cared for a number of patients over the years in the medical intensive care unit where if you were in the MICU, you were on a ventilator. I mean, it was just that high acuity. And I was always struck by the intense anxiety that these patients experienced. And I would dutifully give them medications to try to help them be more comfortable with the ventilator, to be less anxious, to reassure them. And I just found that the more medication I gave them, the more anxious the patients would become. So this seemed like such an oxymoron to me.
There is something about the way the brain works, and I am not a neuroscientist, so I can't explain this, but I can just tell you, after 5 years of experience, that there is something transformative about giving a child an intermediate step in expression. So the things that have happened to our children have happened to them in a subverbal experience. So they've had these traumatic experiences, but they either had those experiences at a time when their language wasn't fully formed, or what happened to them defies language altogether. And so if you give them some intermediate vehicle, and the drum is an awesome intermediate vehicle, they can enact on the drum through sound and rhythm what their words can't tell you. And then somehow, using a different part of their brain, they can interpret what they were playing, and in the process of interpretation, can then share with you what it is you were needing to know all along.
Clavinova connection and health rhythms thus have a dual nature, and that they can be both recreational and tools in specific therapies. They characteristically share a welcoming environment. The welcome is offered by a facilitator who must be able to draw out musical responses in an unthreatening way from the participants.
So individually then, we have a widow who had lost her husband, who was faced with some music that she had experienced with her husband. And it was quite painful for her at the very, very beginning to play some of the songs. But over the course of a quick 8 weeks, it became a strength to her, and it becomes an ongoing memory of her husband. The music that she's playing with the group and in a headphone setting by herself.
What we learned through much trial and error and many mistakes is if you're having trouble rolling your program out, you must do this with your senior management. That's who needs the program first. If you can set this up as a human resources strategy and require your C-suite or your executive management or your leaders within the facility to truly understand it, that becomes the Pied Piper strategy for growing this with your clients. If they don't understand it, there's not going to be that level of buy-in. If someone says, what do you think of that drumming thing? And they roll their eyes, that's not going to produce the benefit that you need. So when we started out with a lot of our research studies early on, we really went to the patient population and we found that the staff was undermining it. When we then took it to the highest level, we had nothing but support.
What we were the most struck by with this study was the empowerment of patients. They had the ability to self-manage their anxiety in an environment that really provides them with no control over anything. Because here we are in the intensive care unit. We can make your heart rate go up, we can make your heart rate go down. We are controlling breathing for these patients. So if you think about, this was one rare time during their ICU stay where they could control something.
In my health rhythms experience, I find that if I can drag the caregivers into the circle with the other participants, they become a catalyst for the other participants. It breaks down a lot of barriers that might exist between caregiving and care receiving.
What they're not telling you is the greatest advantage of what's happening here in Cincinnati is not the Clavinova Connection or the Health Rhythms Protocol, it's the coalition. So you don't have to go to a website. You don't have to look up the research. You don't have to try to find a video on YouTube. There are so many wonderful organizations tied to this coalition that you can call them up. You can actually borrow drums. You can share. You can work together. If you need a demonstration for a grantor, you don't need the money to go out and buy the equipment. There are phenomenal people in this room that will open their doors to you and work together. That's what a coalition is really all about. And that's why this is the foremost coalition in the country in music making. It's not good enough for somebody to paint a picture and ask their peers to say, what do you see in that? But you have to give the person a chance. And you have to be able to do it in a trusting environment. And that's why your programs work so well, because it's not voicemail, it's not email, it's person to person. And there's something happening here that doesn't happen in our society anymore. It's the development of empathy. Trying to understand what another human being is going through. Trying to understand how challenged they are. And if you begin sharing and you begin really doing this from the heart, then we start doing something really novel which seems to have escaped us in our society. We start taking care of each other.